Ebola virus. Ebola virus. Key fact: Ebola viral disease (EVD), formerly known as Ebola hemorrhagic fever, is a severe, often fatal illness in humans with death rate up to 90%. EVD is caused by infections with a virus of the family Flaviviridae genus Ebola virus. History of Ebola virus outbreak: 1976, Ebola first appeared in two simultaneous outbreaks in Sudan and DR Congo. Up until December 2013, a total of 23 outbreaks recorded, 2388 human cases and 1590 deaths. Contained through isolated or affected area. Current outbreak began in Guinea in late 2013 and spread to 4 West African countries. Of late, another outbreak has been reported from DR Congo, where there are 24 cases and 13 deaths. Till 28.08 2014, not related to spread from 4 West African country. How Ebola outbreak start? Zoonotic infection: humans are infected by animal, chimpanzee, gorilla, monkey, forest antelopes, fruit bat, or porcupine found in tropical rainforest. Fruit bat are considered likely host of the Ebola virus based on current evidence. There is no evidence as to how the 2040 outbreak in West Africa started. Transmission: animal to human, and then transmission within human population is from person to person. Direct contact through broken skin and mucous membrane with blood, other bodily fluid, tissue, or secretion, stool, urine, saliva, semen of infected people, or contact with environment contaminated with infectious fluid such as solid clothing, bed linen, or used needle. Ebola: first, viral reservoir fruit bat; second, epizootic in primate; third, primary human infection; fourth, secondary transmission. High risk group: healthcare workers that care of Ebola cases who are not protected with personal protective equipment PPE, family member, caregivers, or other in close contact with risk Ebola patient. Mourners who have direct contact with bodies or secretion of deceased Ebola cases. For countries without Ebola cases, travelers need to be kept informed of their risk. Disease in human. Incubation period: time from infection to onset of symptoms 2 to 21 days. Patients become contagious once they begin to show symptoms. Non-contagious during incubation period and are not detected by lab tests. Symptoms of illness: sudden onset of fever, intense weakness, muscle pain, headaches, and sore throat, followed by vomiting, diarrhea, rash, impaired kidney and liver function, and in some cases both internal and external bleeding. Diagnosis and treatment. Diagnosis: sample from patient are an extreme biorisk and testing should be under maximum containment condition. Treatment: supportive care can help reduce mortality, but there are no known proven safe and efficacious treatment or antiviral drug to treat Ebola. No licensed vaccine or drug are currently available, although some are currently in development. Travel to and from Ebola affected country is low risk. Here is what you need to know. All country WHO recommendation: no general ban on international travel or trade. Provide relevant information to prepare to detect, investigate, and manage cases. Country situation: no case of EVD tilde, regular monitoring of highest level HMM, SEC, HDGHS, and JMG surveillance both at POE and inside country, preparedness of health facility laboratories, strengthening infection control practice, training of manpower, risk assessment, involvement of non-government health sector IMATC. Surveillance measure at POES. Surveillance measures at POES aim the mitigate the risk of EVD surveillance of traveling arriving from EVD affected countries, enhance surveillance at all designated POES, 5 international airport, 9 port and 1 ground cross. There are no direct flight from West African country, screening of travel packs and crew of indirect flight from Gulf country and Colombo at 18 international airport and major port as per the risk criteria. MOHFW Initiative Advisor for Travel, Airline Crew, Immigration Official, APHO, Ground Crossing Staff, Manpower Standing, Orientation Training, Health Card, Display of Health Alert, Backup Support, Hospitals, Lab, Screening Process, Use of Health Card, Categorization of Travel, Law, those who have only H or travel to EVD affected countries, medium those who have HO contact, and high risk who have HO travel and or with sign or symptom of EVD. Low risk to be given advisory for monitoring their health for next 30 days. Refer to travels with medium risk to IDSP. Refer to travel with high risk to identify quarantine or isolation facility of testing and treatment, enlisting and refer of contact of medium and high risk, special risk group, army, MEA, feedback, medical staff, other designated hospital and laboratories. List hospital has already been communicated. NCDC Delhi and NIV Pune are the designated laboratories. List IDSP, SSOS and DSOS has also been communicated to all APHOS, PHOS. Letters have been written by Secretary Health to Secretary of MHA, MEA and MOCA by Joint Secretary, all Principal Health Secretaries of State, Status of Manpower, Logistics and PPE. A person who is infected is only able to spread the virus to others after the infected person start having symptoms. WHO believes that countries have healthy symptoms that are prepared to respond can quickly contain any important cases. Thank you.